In a complex world like the healthcare, we have a lot of factors that influence the quality performance of the healthcare provider and the relationship between the provider and the recipient of care. In healthcare, you're going to find that one single customer, the patient, is receiving the service from the multiple providers. Reflecting that, we need to have a system of consistency, a system of quality, a system of excellence. And that's what we are going to learn in this training. In this training, we're going to discuss healthcare quality management, how to achieve excellence in healthcare setting. In 1999, there is an entity called the Institute of Medicine in the United States released a report called To Err is Human. And in this report, they talk about a bigger number of the people die unnecessarily from preventable deaths. When they counted, they found that it ranged between 44,000 up to 98,000 people die unnecessarily from preventable deaths in the hospital under the insurance system. 2 years later, they released another report to tackle the problem, where they said in the report called Crossing the Quality Chasm or Crossing the Quality Gap, what should we do and what we have to focus on to improve the performance in healthcare. So they start to give us the definition of quality in healthcare. So what was the definition? The definition is healthcare quality is achieving the best possible outcome to the individuals and to the community based on the scientific knowledge. Meanings, when we deliver our services, we need to give our patients, our clients, our community the best service that we can, depending on up-to-date evidence-based practice, whatever it is. So if it is in medicine, it should be evidence-based medicine. If it is in surgery, it should be evidence-based surgery. If it is in private practice, like the physiotherapy, the lab, radiology, should be on the latest protocol and guidelines and procedure manual that's available at that time. This is how we need to define the healthcare according to the Institute of Medicine. But there are many other definitions for the quality. Let's know them one by one. One of the quality gurus start to define quality as quality is fitness for purpose. It's simple and easy as an example of definition where we are actually going to decide what we are going to use and is it fit for the purpose or not. For example, if you are going to use the stethoscope, the main purpose of the stethoscope is to hear the heart rate and murmur. So if it does work, so this is a quality product. Why? Because it's fit for the purpose of listening to the heart rate and murmur. If you are going to use a sphygmomanometer, which is the blood pressure machine, so if it does work and if you can come up with the right measurement of the blood pressure, so it's fit for purpose. Similarly, whenever you are going to use the surgical instruments, the equipments, the machine in lab, radiology, physiotherapy, if these types of the equipments and machine that we use are fit for the purpose and give us the intended purpose of the procedure, so you are using a high quality product. Similarly, when you are going to decide what should I do, you have a patient and the situation is a little bit critical. What should I go for? Whenever you come up with the right decision where you are going to go for the exact potential outcome, so it's fit for the purpose. This approach is fit for the purpose of this situation. Now you come up with a quality decision. This is the first definition, fitness for purpose. Another quality guru come and define quality as right thing at the right time. Right thing at the right time, what does it mean? It means that whenever you have a very complex situation, a patient, for example, a child who is suffocating at the moment from ingestion of a foreign body, and you tried a lot to push the abdomen to come up with a foreign body, but you couldn't. So the one and only situation at the moment is to do tracheostomy. So if you do have the competent people, the trained staff who can do the tracheostomy, and you do have the needful instruments to do the tracheostomy in a very potential place, so this will be the right thing at the right time. You come up with the right approach at the right time. Very much similarly, you are in the mid of a crisis in surgery. Should I go with removal of the organ or not? When you come and have a discussion, what should we do? and you come as a team with a consensus that we need to go with this removal of the organ, and we all agree because this is for the right of the patient, this for the goodness of the patient, so go and do it, then it's gonna be the right thing at the right time. A third definition is right first time. What does it mean, right first time? It means that we do the things right from the first time. And this is one of the common challenges that we do have in the healthcare. In healthcare, how many times the doctor didn't come up with the right diagnosis? Millions of times. The doctor doesn't come up with the right management plan. Millions of times. The nurse didn't come up with injecting the right medication. Millions of times. The lab collect inappropriate amount of blood for the lab testing. Millions of times. Similarly, radiology staff didn't take the right imaging. Physiotherapist didn't do the right approach for the management of the patient, and many more. So whenever it comes to we are doing the right thing from the first time, this is quality performance. Whenever we have a medical errors, so it's violate the definition of doing right thing from the first time. So this is violation of the quality. Medical errors are violation of quality according to this third definition. Now let's talk about the fourth definition. The fourth definition is conformance to standards. Simple and easy. We need to have a standards of performance for every single healthcare professional. What does it mean? We need to have a guidelines for medical doctors. We need to have protocols for surgeons. We need to have the standard operating procedures for nurses, for pharmacists, for lab, for radiology, for physiotherapists. So whenever we have this in hand and we are complying with this type of the standards, then we're gonna have a quality performance. Then it comes to the fifth definition, what customer wants. What customer wants, this is a very much perspective of talking about people. What our clients, what our customers, what our patient wants from us. They want dignity, they want respect, they want quality performance, they want safety, they want confidentiality. So if we provide what exactly our customers, our patients are looking for, then we are providing a quality services. And finally, it comes to an economical aspect of quality. It said value for money. What does it mean? It means like we are providing a service that is efficient. We don't spend a lot of money to come up with the outcome. We need to spend a little resources to come up with the highest possible positive outcome, focusing on removal and avoiding all the potential waste, all the non-necessary steps, all the non-necessary consumables. We are saving a lot of resources, we are saving a lot of money, but at the same time, we are focusing on achieving the target, value for money. Those are the 6 definitions of quality according to the quality guru. Now, let's come to the last definition, the very common definition in healthcare, which is doing the right thing right from the first time and every time. And for this definition, I'm going to talk about it in details in the next session.